Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Absolutely no-brainer to have that if you're out in practice, if you're preparing for pharmacology classes or exams, whether you're a nurse, pharmacy technician, student, med student, whoever. Go check that out. Absolutely free to use. Simply an email will get you access. We also get you updates when we've got new podcasts and other content available as well. So go do that, reallifepharmacology.com. The drug of the day today is polyethylene glycol. Miralax is probably the more common brand name you're going to hear there. I'll hear the abbreviation periodically, PEG as well, or PEG. So this medication is used for chronic constipation, also can be used for bowel prep in colonoscopy, also can be used kind of on an as-needed basis for the management of constipation as well. This is what's called an osmotic diuretic. So from a mechanism of action standpoint, essentially what an osmotic agent does is it causes water to help come into the bowel and stool ultimately, which can help kind of stimulate or produce a bowel movement. So, of note with Miralax, it is not absorbed into the bloodstream, at least to a significant extent. There's maybe a very, very tiny fraction. But essentially none of it is absorbed, or virtually none of it is absorbed. So it stays in that colon, draws water from surrounding tissues into the bowel, and that's ultimately going to soften the stool. More water you have in the stool, the softer that stool gets. This increase in stool volume and softness helps to stimulate natural bowel movements. And probably the most clinically advantageous benefit of this, occasionally I'll get some patients that really struggle with like stimulant laxatives that actually promote the contraction of the bowel and those muscles working. So Miralax does this without causing as much cramping as, let's say, stimulant laxatives like Bisacodyl or Senna, for example. All right, so Miralax is also used before colonoscopy and various gastrointestinal procedures, and this is done to essentially completely empty your colon of particulates and things that may be difficult to see through or see around as a GI provider is doing a colonoscopy, for example. So basically Miralax can be used for that prep to essentially clean out the bowel and allow for easier viewing. That bowel prep is a large amount of Miralax, 238 to 255 grams, kind of depending upon the product we're using there. And it's mixed in a lot of water, 64 ounces. It's approximately 2,000 mils, a little bit less than 2,000 mils, 1,900. And oftentimes providers will mix that with Gatorade or recommend mixing that with Gatorade. There is kind of a unique nugget to remember about Gatorade. It's not just any type of Gatorade. Typically, like a lemon lime is used. It is recommended to avoid red Gatorade. So there's a couple potential reasons for that. It may make it more cloudy to see in that colonoscopy, or more difficult to see. But also the red dye could mimic blood. Okay, and obviously, that would be pretty concerning for a provider that's performing the colonoscopy. So makes it a little bit more harder to visualize things, and then it may mimic the look of blood there as well. From a dosing standpoint for management of constipation, Obviously, we're not using that much medication. We're not trying to, totally clean out the bowel when we're treating constipation. So dosages are obviously much, much lower than the colonoscopy prep. Usual dosing I see in practice is 17 grams in 4 to 8 ounces of water daily. 34 grams I see occasionally, and that can be done. You might get a little bit more bang for your buck there, but you may also see some higher incidence of side effects as well. So again, most patients, 17 grams is probably going to be enough. Now I want to talk about the water component a little bit. So 4 to 8 ounces of water is the recommended mixture. With that said, you may have patients with something like heart failure, for example. So then we're probably going to try to use that lower end. But in general, more fluid intake can help in alleviating constipation in itself. And then obviously adding that with the medication, hopefully that's going to be kind of a double whammy to help alleviate that constipation that patient is experiencing. There is weight-based dosing for pediatric patients. It is used in pediatrics. I've definitely seen that a few times, obviously, throughout my career. With that said, I'm not going to get into the details on weight-based dosing, but just know that that's out there and to pay attention to that. And obviously, we shouldn't give the adult dose to a pediatric patient in most situations. So let's talk adverse effects a little bit. GI upset's probably going to be most common. We can have some, cramping, some gas. Obviously, diarrhea can happen. We're trying to promote and get rid of constipation. So if we go too far or use too much or, the patient's responding too well, you could get some complaints about diarrhea there. So obviously in that situation, we're just going to, stop the medication, reduce the dose, whatever we need to do there to manage that. There have been some electrolyte disturbances reported, probably more so along the lines of higher doses and using it frequently. If you think about this from a logical standpoint, we are pulling water into the bowel. With that, electrolytes can go with that. If a patient's having too many bowel movements, more along the lines of diarrhea, electrolytes certainly could go with that. So there is some potential there for electrolyte deficiencies. Can't say I see it terribly often. My patient population, they're getting their labs checked fairly frequently anyway. So somebody on, let's say, a chronic Miralax dose, we're probably monitoring those labs anyway. With that said, I do want to mention that Miralax does not contain sodium or potassium. So those are often, common electrolytes that we monitor. So it's not going to raise those at all. Also, it doesn't contain magnesium. So we've got a product like milk of magnesia, that contains magnesium to help treat constipation and produce a bowel movement. In patients with poor renal function, if we're using that milk of mag frequently, that could lead to a situation where we get higher magnesium levels and accumulating magnesium. So we don't have to worry about that with Miralax. All right, here's a huge patient education point. Many patients have the expectation, similar to taking a pain medication, that my problem should be resolved within, 15, 30 minutes to an hour. Like I should start feeling better. I should start feeling pain relief, for example. Well, Miralax doesn't work that way with constipation. It can take, anywhere from 1 to 3 or 4 days for that medication to start working and basically produce a bowel movement, which is what we're trying to do there. So really, really make that point clear to your patients that it is going to take a little while typically for this bowel movement to be produced when we're using Miralax for the treatment of constipation. I mentioned a little bit about the absorption. There's minimal systemic absorption with the use of Miralax. So that's typically not something that we're going to need to worry about there. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, NAPLEX, go check out meded101.com/store. We've helped thousands of pharmacists prepare and pass their board exam. We can absolutely help you too. So go check that out. Support the sponsor, meded101.com/store. All right, wrapping up with drug interactions. Miralax is one of those medications where I don't worry about many drug interactions. First and foremost, from a polypharmacy perspective in my geriatric patient population, I do have a lot of patients that take Miralax on a chronic basis. Okay, a lot of these patients are, not very mobile. They don't do a ton of fluids. They're definitely at risk for constipation. But in my work as a pharmacist, I definitely take a look at that medication list and make sure that the medications we're using are appropriate and helping whatever disease state condition they're taking them for. But I also look to review and say, hey, this patient's taking constipation medication. They're on Miralax, they're on Senna, they're having trouble with constipation. What medications are they taking, and can we eliminate or reduce any of them that cause constipation? And some of the most common examples I encounter are opioids and then drugs with anticholinergic activity. So, medications like the tricyclic antidepressants, for example, first generation antihistamines like diphenhydramine, some of the bladder anticholinergics, tolterodine, oxybutynin. Iron supplementation, definitely a common cause of constipation. Even some of the antihypertensives, calcium channel blockers are well known to be contributors to constipation. So when you write for a new prescription Miralax, if you're a provider, when you dispense, if you're a pharmacist, when you administer Miralax, if you're a nurse or other healthcare professional, definitely take a look at that med list, or have somebody who's trained to do that look at that med list and say, hey, are there things we're doing here where we can reduce other medications to try to help relieve that patient's constipation, and maybe we can get by with not using Miralax, or at least a lower dose of Miralax, for example. So that's what I think about from a drug interaction standpoint. It has been reported with digoxin that concentrations may be lowered when using Miralax. So it's something to think about, not something I stress over too much, but it may not hurt if you've got a patient taking chronic Miralax therapy to keep an eye on those dig levels and make sure that they're remaining stable and at the desired target that we want there. All right, well, that's going to wrap up the podcast for today. Thank you so much for listening. Do me a huge favor, leave a rating, review on iTunes or Spotify or whatever platform you're listening on. I greatly appreciate that. It helps me grow the audience. So take a second and do that. If you want to email friends, colleagues, students, listservs, the Real Life Pharmacology podcast, we've grown that way as well. I greatly appreciate that. Definitely helps us expand the audience and teach more people about pharmacology, which is what I love to do and what I'm passionate about. So definitely feel free to do that. Yeah, comments, suggestions, mededucation101@gmail.com. Also, please support the sponsor, meded101.com/store. All your purchases there go directly to help support this podcast. So I greatly appreciate that. With that said, I'm going to sign off for today. Thank you so much for listening. Take care and have a great rest of your day.